Enzyme therapy is a huge part of our practice. We can really help patients that we weren't able to help previously with just our hands. Some of our patients have both physical or structural problems, and they also have chemical or nutritional problems that are causing their pain and their symptoms.
And I'm the kind of guy that I don't believe in anything. And I really did not believe in the enzyme program. I really didn't believe in the urinalysis. I didn't believe anything at all. What I finally did believe in is when I saw the results and I felt better and I'm able to move around instead of every day going to work, dreading everything, coming home, taking my suit off and just hitting the couch because I don't feel good. I'm bloated, acid reflux from so on and so forth. In my job, you take a lot of clients out, so it would very much wear me out. Now I have so much more energy and I do so much more.
I personally suffered with acid reflux and irritable bowel syndrome for all my life. I was on all sorts of medications since I was in my teens, and every year my symptoms progressively got worse, and so did my diagnosis. Unfortunately for me, the doctors were really never able to find anything on the examinations. They told me I had a faulty esophageal valve, they told me I had acid reflux, I had GERD, I had irritable bowel syndrome. After years of taking antacids and PPIs, I was fed up. I finally found an enzyme therapist who practiced Loomis's enzyme therapy. 2 days after I started taking these enzymes, I no longer had to take any antacids or PPIs. 6 years later, I have still never taken another antacid or PPIs. These are things that I lived on. I cannot go out to dinner without having to take 2 or 3 or 4 Rolaids, Tums, Prilosec, Prevacid, Nexium in order to live throughout this meal pain-free. Half the times we'd go out to dinner, I'd have to go home in the middle of the meal due to uncomfortable symptoms.
Whenever you're hurting, your quality of life some way, somehow is going to be diminished. For me in particular, with my stomach, it precluded me from eating the things that I wanted. It precluded me from doing the things that I wanted because of discomfort. With my shoulder, it absolutely shut my life down. I was not able to lift, I was not able to pull, I was not able to sleep. So my quality of life was greatly affected by especially my shoulder situation, which was a calcific tendonitis. Again, the treatment that Dr. Cooper had rendered to me via the enzyme therapy and the chiropractic care saved me from cortisone injections, saved me from prescription medication, and saved me from surgery.
Not only did my stomach symptoms disappear, what I started noticing was other things that were interfering with the quality of my life also started to improve. For instance, I was under 30 years old, I was not overweight or obese, and I was suffering from high cholesterol and high triglycerides. I also would wake up 4 nights a week with terrible cramps in my calves that would actually wake me up at night, and it was very disturbing to me. I also had little energy during the daytime. I felt like I needed to take naps all the time, and I also suffered from a little bit of anxiety. When I started taking these enzymes, which I thought were just helping my digestion, all these other symptoms started to improve. I was always wondering why my patients, after taking calcium and vitamin D for years, would still end up with osteoporosis. What I realized through my learning of enzyme therapy is that when you digest and absorb your food better, it nourishes your body and your organs and your glands. And when you get proper nourishment, these symptoms slowly start to disappear. So all of a sudden I was giving my patient enzymes that helped them digest and absorb protein and calcium, and their bones were getting stronger. I was eating food that I was now able to digest, and my cholesterol and my triglyceride levels got better. My cramping disappeared. I haven't had a cramp in 5 years in my calves at nighttime while I was sleeping. And so I started to realize that headaches and back pain and all these other things that I really couldn't get better with my hands were also starting to improve. You may have heard the saying, you are what you eat. To me, that's only partially true. The true definition of nutrition isn't only what you eat, but it's how you digest, it's how you absorb, it's how you utilize, and eventually how you eliminate your food. So we falsely assume that if we eat well, our bodies all work the same to digest, absorb, utilize, and get rid of your food. Lactose intolerant is the perfect example. If you're lactose intolerant, you can't digest milk properly. Therefore, milk may not be good for your body. But somebody else who may digest milk properly, milk may be good for your body. So everybody digests, absorbs, and utilizes their food different, and this is the key area where enzymes come into play. How come some patients lose weight on a certain diet? Some of my patients will lose a lot of weight on a certain diet, while some other patients will do the exact same diet and they gain weight. This all has to do with how you digest and absorb and utilize your food. What we do in the office here is based on a complete physical examination, urinalysis, and signs and symptoms survey, is we can determine what foods your body digests properly and what foods your body does not digest properly. Once we find that out, we can give you an exact food plan and a food diary of foods that are going to work great in your body, which are going to increase your energy, which are going to allow you to sleep through the night, which are going to decrease your weight, which are going to help lower your triglycerides and your cholesterol. It can even lower your blood sugars. So finding out what your sediment rate is and how you metabolize certain foods is an extremely part of finding out what foods you should be eating and what enzyme supplements you should be taking. We have over 50 different enzyme supplements, and they're very specific for each individual based on their physical examination and urinalysis findings.